Hello, my name is Ara Keshishian, and I would like to talk about alcohol and weight loss surgery. I want to start setting the foundation as to why are we talking about even alcohol and its implication with weight loss surgery. This is to highlight a couple of points. One of them is that we need to appreciate the short and long-term implication of drinking alcohol into our general health, both the benefits and the downsides to it. Um, Also, the implication of alcohol and how it relates to weight gain, and that some of the results of patients that don't lose weight may be caused by patients who are consuming too much alcohol too fast during their weight loss phases. Talking about alcohol, we're going to discuss the use of alcohol in the United States, its metabolism, and specifically its effect on the brain, the detrimental effect, the short and long term when it comes to nutrition, liver, and its relationship and its significance in pregnancy, the relationship and interaction between alcohol and some of the drugs, and the benefits of the alcohol. Alcohol use in United States, it's been reported as following: one third of the U.S. population has one or more drinks per week. One third of the population rarely or never drinks. Um, this rough numbers are 100 million drinkers, 10% of which are alcoholic. And now we realize that there is a significant genetic component um, to a patient being alcoholic. Um, 10% of the drinkers consume 50% of the alcohol in the US, and 39-40% of the adolescents are moderate drinkers. About a quarter of the adolescents are sort of the problem drinkers, that their drinking may um, have psychosocial and health implications for them. There's some studies that have also talked and identified that 5% of the high school students drink daily. As we all age to the college age time frame, 7% of the freshmen drop out of college, and a third of them have to do with alcohol use. 82% of the surveyed college students at one point had reported that they had drank during the month prior to the survey, and about half of them, 54%, had binge drinking. That's more than 5 drinks at a time in the last 2 weeks. This has progressively become a bigger problem in college campuses when it comes to the culture of drinking, specifically binge drinking. Um, Patients that uh, consume excessive amount of alcohol uh, are twice as likely as use marijuana or pot, and 6 times as likely to use cocaine. Now, clearly, some of the slides have been based on research that's been available out there for years, and as our understanding of medicinal value of the marijuana is coming to light with more research in the pipeline, sure that some of our understanding with its relationship to alcohol will also change over time. Alcohol can be construed as a drug per se if taken in excessive amounts. Um, Drugs causing most death per year is tobacco. Second is alcohol, and alcohol linked to most child and spousal abuse. As on one of the earlier slides, we talked about psychosocial implication of alcohol abuse. There may be significant amount of undiagnosed, underdiagnosed, or untreated psychological illnesses associated with alcohol abuse. Talking about the mortality caused by alcohol, half of all accidents, suicides, murders are alcohol related one way or the other, either acute setting or a chronic depression caused by alcohol or contributed to by alcohol. 40% of all Americans will be in alcohol-related car crashes. Um, a third of the pedestrians killed were drunk, and cirrhosis is the of the liver is the ninth leading cause of death in U.S. And in all of those conditions highlighted above, one or the other individual involved of the individuals involved has used alcohol, and alcohol statistically is the most used and abused alcohol drug in the US. Let's move on to a little more scientific information. The metabolism of alcohol requires no digestion per se. It's absorbed rapidly across all mucous membranes, and also is absorbed very rapidly through the mucosa of the small intestine. Um, Liver treats it as a toxin and tries to protect the body. It will take about 60 to 90 minutes to process and deactivate, neutralize, if you would, alcohol ingested. And there's clearly some genetic and ethnic variation into how a body responds to alcohol at certain volumes. There's been studies done that found the weight loss surgical patients ingest far less alcohol to increase their blood level. Um, these studies are showing that the peak alcohol level is much sooner, and the exact cause of this is not very clear, even though we have some ideas that there's increase in enterohepatic circulation, especially with duodenal switch, and the proximal bowel exposure may be such as the duodenal switch or the gastric bypass, when the small bowel, the distal end of the small bowel that may have a higher enterohepatic circulation, is exposed to the alcohol sooner because of the reconstructed anatomy. The function of the liver detoxifies the poison, both those produced by the body and those produced and ingested from outside. So the liver acts as essentially a filter slash refinery, and when alcohol is consumed, um, being that it's toxic, it is processed in the liver, to taken to the liver to be detoxified. Liver also filters the bacteria from the blood, regulate their regulation processing of cholesterol, fats, and vitamins and minerals. It also maintains the body's salt and water balance in conjunction with the kidneys. It secretes the bile for digestion of the fat. It's also a storage environment for glycogen, which is a type of a stored glucose in the times of energy and caloric excess. Um, it also transforms the highly toxic ammonia, which is sort of a byproduct of the protein metabolism, into urea, which can be eliminated in the urine. It also produces the components such as lipoproteins and other surface proteins that are required to transport and processing of the fat and the cholesterol. And last but not least, when we're talking about this, our discussion here, it metabolizes the alcohol. When alcohol is ingested, 90 to 95% of it is eventually taken up by the liver, where 10 to 15% of it is processed by the MUS, the microsomal ethanol oxidating system, and 70 to 80% of that 90-95% is processed by alcohol dehydrogenase. About 5 to 10% of it is taken into the lung and the kidney for excretion. With weight loss surgical procedure, one of our main concerns is it's the state of the liver prior to weight loss surgery, and the long-term effects of um, nutritional deprivation that's caused by the weight loss surgery, in addition to any toxins that may be stressing the liver, and one of those is alcohol. So those two images show normal and abnormal. The abnormal is on the right upper part of the slide, with you see those large clear white goblets They're essentially fat infiltration with the living parenchyma, and that's what's known as steatohepatitis. Um, so liver can be injured by any of those components that one way or the other address its function, as we talked about 2 slides ago. So the ones that are pertinent to our discussion is the steatohepatitis or fatty liver, infections by hepatitis, viruses, family of the viruses, drugs that are hepatotoxic, and liver. Going a little more detail into the effects of the alcohol, short-term effects of the alcohol, it slows processing of the carbohydrate, fat, and the protein in the liver. It accumulates in the liver, which is reversible. It is a decreases the antidiuretic hormone, so it causes dehydration. So drinking beer as a part of preparation to surgery to hydrate for hydration is not a proper thing to do. Brain, there's been evidence that alcohol at certain level will slow the mentation and thought process applications. It also is known to depress nervous systems. Um, Depressive effect on the brain. The first, it affects the frontal lobe, the reason, judgment, inhibition. So um, when someone is intoxicated with alcohol, they may do things that later on they would consider improper or inappropriate. That's because their judgment and inhibitions were suppressed with the alcohol. There has been slurring of the speech and the vision. There may be staggering, large muscle control is diminished, consciousness, and in extreme cases, we will stop a patient or an individual will stop breathing and they may die as a result of alcohol toxicity. Uh, a drink, in the case of a beer, is 3 to 6% alcohol, a wine 12 to 14% alcohol, and liquor or spirits are 40 to 50% alcohol. Um, Looking over chronic alcohol and nutritional issues, alcohol has 7 kilocalories per gram. This is empty calories, which means that independent of the length of the small bowel in the duodenal switch operation, independent of the length of the Roux-en-Y in the gastric bypass, and irrelevant to the size of the pouch with regards to the lap band, alcohol that's taken by mouth is easily absorbed through all of the mucous membranes and the mucus of the small bowel, as we discussed earlier. It decreases use of fat for energy by a third because the alcohol itself is very easily absorbed and it's processed easily to become energy. Generally, it decreases the appetite and food intake, decreases absorption of some of the vitamins, increases excretion and need for vitamin and minerals, and increases risk of malnutrition. Chronic alcohol and liver increases fat in the liver for short term, which is reversible. This is one of the things that we will see every so often in a chronic alcoholic patient who, if one was to look at their livers before they become cirrhotic end stage liver disease individual, their liver will go from normal to steatohepatitis, fat infiltration of the liver, and essentially progress to end stage liver disease. Long term progressive alcohol use, depending on what stage it is, it will go from fatty liver to hepatitis to cirrhosis, and those stages are reversible till the stages of uh, fibrosis and cirrhosis, at which time the liver structure is not reversible. However, there's enough reserve in the function of the liver to maintain. However, continued insult may push that functional load of the liver to be diminished so much so that the patient will require transplant, for example. Chronic ingestion of the alcohol inhibits breakdown of the fatty acid in the liver, and it releases the very low density lipoprotein, the VLDL that you see on your laboratory studies. These are fats that are culprit in causing plaque build in arteries. It's important that we also talk about fetal alcohol syndrome in relation to weight loss surgery. Two-thirds of our patient population seeking weight loss surgery are females, and a large percentage of them at some point or another by choice or by accident may become pregnant. Um, 1 out of 750 births in the US has fetal alcohol syndrome, but this is estimated that 2% of all the births are affected by alcohol. One of the most common causes of mental retardation, facial, and physical abnormalities. Um, Less severe form of fetal alcohol effect may be associated with some learning behavior and coordination problems. The take home message would be that no amount of alcohol should be considered safe during pregnancy, and that a fetal alcohol syndrome may be the end result of one of the extreme cases of alcohol exposure of the fetus, yet there is a spectrum of condition that may be result of alcohol during the pregnancy. Risk increases with binging frequency and drinking early in the pregnancy. It's 100% preventable, and that just essentially don't drink. Any alcohol during pregnancy poses the risk, and if you don't drink, do only so after eating and a very limited amount. Alcohol and drug interaction. Um, if a patient drinks and takes drug, the alcohol processes first, so the drug affects longer and stronger. Alcohol is a depressant, so it enhances the effect of the drug with depressant actions. So one, if a patient is taking an anti-anxiety medication, taking alcohol would be like taking the anti-anxiety medication at twice the dose because they both have a depressive effect on the brain. Among chronic drinkers, MUA system increased. So if you're drinking and taking drugs, then higher MUAS activity processes result in faster medication breakdown, which will weaken the effect. The benefits of the alcohol are small amount stimulates appetite and social setting. Uh, in some studies, it's been reported that some nursing homes provide some alcohol to their residents as a means of increasing their caloric intake. There's been some improvement in the HDL and to reduce cardiovascular disease, even though in the previous study we said that excessive amount of alcohol can increase the VLDL, which is a detriment to cardiac or vascular health. The J-shaped mortality curve means that abstaining and heavy drinking have higher death rate than individuals that drink in moderation, realizing that moderation is a very subjective term, but as it is in alcohol, in treatment of alcoholic environment, one of the most common questions that one has to ask is if people around you think you drink too much, then you drink too much. I'm going to wrap this up by essentially asking the questions and answering them. Can I drink? When can I drink? How much can I drink? As a weight loss patient, can I drink? The answer is yes. When can I drink? As late and as far away from your surgery as possible. And how much can I drink? As little as possible. Um, to review these things in a real short format, when can I drink? I think the answer to that question needs to be taken into the context of how far are we from surgery. If a patient has 200 pounds to lose and they have their 2 weeks post-op, clearly they should not be drinking no matter how little. If a patient is 10 years out and they've got a family reunion come to and they've maintained their weight, it would be okay for them to drink a glass of wine once or twice a week. Um, and that how much can I drink? I think it's a relative term, realizing that alcohol in weight loss surgical patients will result in much higher processing, much faster processing, and a faster and higher peak is achieved with alcohol. Thank you.